measure volume growth. And I want to examine some of the forces that could affect the volumes across healthcare. So uninsured rates, they are at an all-time low of 11.9%. Now Medicaid expansion, insurance exchanges, and Medicare enrollment have collectively helped us to get to this spot. Now specifically, on the topic of Medicaid expansion, I know that there are some contentious debates that are still out there, but I think it is quite clear that through Medicaid expansion, we have been able to serve millions of new patients on narrow margins. Now, if you happen to be a provider in states that have opted out, well, I think your organization will actually face another challenge. We expect average margins to decline by 2.4% as a result of lost volumes, increased unreimbursed care, and other factors that are associated with this underserved population. And with health system margins already quite tight, that will be a tough blow for most providers to absorb. All services, including imaging, we're going to have to pitch in to make up for those financial challenges. Now next up is the public exchanges. We've got 16.8 million individuals who are enrolled on the public exchanges. I think it's a fairly impressive number, but I think what we find equally exciting is the age distribution of those enrollees. So we've got our young, likely very hale and healthy population who are flocking to the public exchanges. Though, think about it, these guys are not the big imaging utilizers. They are probably low utilizers of imaging. And on the far right of that age distribution, you'll see that we do not have the 65 plus individuals, and that's because those individuals are on Medicare. But what we do have is a reasonable percentage of enrollees who are in their 50s and in their early 60s, and it's these individuals who will likely contribute to imaging's volume growth.